The first lecture about the respiratory system will be assessment, um, diagnostic procedure, and physical exam. Um, a lot of information could be considered as a review for the previous semester. يعني هي مراجعة من محاضرات الفصول السابقة. This picture clarifies the anatomical structure of the respiratory system, the upper and lower respiratory tracts. Let us start with the upper. The respiratory system starts from the nasal cavity, nostril, مداخل الأنف، التجويف الأنفي، ثم الفارنكس، larynx, the trachea divided into left and right from the carina, then left lung and right lung. Once we divide the trachea to the right left part, we enter to the lower respiratory tract system through the trachea bifurcate تتفرع يعني left main bronchus و right main bronchus, then bronchioles يعني القصبات ومن ثم القصيبات الهوائية, then after the bronchioles we have the alveoli الحويصلات الهوائية included within the left and right lung. Thoracic cage, muscle of ventilation, lungs, pleural space, all of these included within the mediastinum. The thoracic cage contains 12 vertebrae, each with a pair of ribs. زوج من الضلوع على left or right. The posterior part, each rib attached to a vertebra. In the anterior chest cavity, we have 7 ribs attached to the sternum directly. Then we have the 8th, 9th, 10th ribs attached by cartilage, and this cartilage attached to the sternum. And we have the 10th and the 12th floating ribs, which didn't attach to the sternum but attached to cartilage. The muscle that elevate the thoracic cage are classified as a muscle of inspiration. The major muscle involved within the inspiration process is the diaphragm that is innervated by the phrenic nerve. This picture clarifies the structure of the left and the right lung within the mediastinum. Also, the mediastinum contains the heart, the great vessels like the aorta, the esophagus, the trachea, the left and the right lung. The left lung has oblique fissure that divide the lung into upper loop and lower loop, while the right lung has 3 loop. The horizontal fissure divided upper and middle loop, with the oblique fissure divided middle to lower loop. The left lung is taller but narrower than the right lung because of the heart, while the right lung is wider and shorter than the left lung because of the liver. Lungs protected by thoracic cage, air-filled spongy structure. كلung tissue هي spongy structure سفنجية. As we said that the right lung contains 3 loops while the left lung contains 2 loops. The base of the lung located at the 6th rib at the mid-clavicular line, and at the 8th rib at the mid-axillary line. The apexes of the lung are 2 to 4 cm above the clavicle. هذا هو حدود اللung, the upper and the lower parts of each lung. The space between the two mediastinum contain the heart, blood vessels, lymph node, lymph, thymus gland, nerve fibers, and esophagus, as we said previously. The pleural membrane surrounding the lung, parietal pleura lining the chest wall, and the visceral pleura overlies the lung parenchyma, so that there are 2 layers, visceral حشوية that attach directly to the lung, and the parietal that lining the chest wall التي تبطن الجدار الصدري. These two layers, between these two layers there is a fluid to ease the process of inspiration and expiration and decrease the friction. There is a pressure in the pleural space within these two layers, between these two layers, and this pressure is less than the pressure within the lung, and it should be negative pressure, which keep lungs inflated. Tracheobronchial tree consists of trachea, bronchi, bronchioles. As we said, trachea allow the hollow tube connect larynx and bronchi. Trachea divide at carina into two bronchi, right bronchus, which is wider and shorter, and the most common site for aspiration. لأنه الأسبيريشن هي entry of the stomach content toward the lung. كونها shorter and wider، كونها أقصر من left main bronchus، فأول ما يطلع الطعام من المعدة كونها أوسع أعرض، مسافتها أكبر وأقصر، فبيدخل الطعام فيها مباشرة. إذن the right bronchi, it's wider, shorter, and it's a common site for aspiration. common site for aspiration. احنا عرفنا شو معنى aspiration اللي هي food regurgitation toward the lung. Then we have loop, segmental bronchi, bronchioles, terminal bronchioles, respiratory bronchioles, alveolar ducts قنوات الحويصلات الهوائية، و alveolar sac اللي هي الحويصلات أو الأكياس الهوائية. In the lung, approximately there are 300 million alveoli, which equals approximately 85 meters squared. It is the area for the gas exchange. This picture clarifies the process of gas exchange. On the right, the deoxygenated blood from the heart, from the right side, that is carried toward the lung. Then the gas exchange occurs using the dense capillary network that surround the alveoli, so that the oxygen will cross this capillary network from the alveoli to the capillary. Then the CO2 will cross from the capillaries toward the alveoli to be exhaled outside of the body. Then the oxygenated blood will return back to the heart, to the left side of the heart, to be ejected. The bronchial circulation is different from the pulmonary circulation. The lung as a body organ need oxygen, need oxygenated blood to nourish the lung حتى نغذي اللung, so that there are the bronchial arteries that perfuse the lung. Side of the thorax arise from the aorta, and the arteries that perfuse the right side of the thorax branch from the internal mammary, subclavian, and intercostal arteries, so that the lung receive its blood or oxygenated blood to be nourished from the left, from the aorta, from the thorax, and from the right, from internal mammary artery, subclavian, and intercostal arteries. The pulmonary circulation arises from the pulmonary artery that provide for gas exchange function. Here is different. الآن احنا بنحكي عن الجاز exchange part، وقبل شوي حكينا كيف lung itself will receive its oxygenated blood. The deoxygenated blood leave the right ventricle and enters the pulmonary artery. Then after that go through the branches, arteries, capillaries, and exchange through the alveoli. Then the oxygenated blood transported through the pulmonary veins toward the left side of the heart. Alveoli. There are three types of alveoli. Type 1 alveolar cells, epithelial cells that form the alveolar wall, تركيبية, structure. Type 2 alveolar cell which produce the surfactant to prevent alveolar collapse. And this surfactant is a material produced inside the alveolar cells in order to keep the alveoli open. Type 3 macrophage phagocytic cell that ingest foreign matters, play a role in immunity.